Hi, I'm Bruce Spurlock, a physician and healthcare leader committed to helping decision makers and leaders navigate change with clarity. At Viral Healthcare, we explore the trends spreading across all of healthcare and how to implement them sustainably and effectively. So, what are non fungible tokens? Basically, they're these blockchains, these digital signatures that could say you're the only one. They create a scarcity of one or maybe two or three so that a device, an item, a painting could be identified with the sole owner very accurately. It's like putting a number on a painting when there's like 20 of them and saying, I have number one, because I have the blockchain to be able to prove it. And from 2021 on, it was incredible how fast and what everybody was putting on. There were whole departments in art organizations and in trading organizations and in these the places where they do auctions and those kind of things to show authenticity and single ownership. And people thought this was the way of the world. I mean, it was incredible how fast it really rose, and then equally how fast it collapsed. So from 2023, there was the art NFT world that was worth like 2.9 billion, and just 2 years later was worth like 23.8 million, a drop of 93% in just 2 years in value. I mean, the whole market collapsed. People don't even really talk about them. I mean, I think there are a few out there that still hold on to this, but by and large, that whole trend came and went. So is that something like we do in healthcare? Well, think about many of the things that have happened over the last 10 years that have equally been boom and bust so rapidly. Things like um, population health platforms. Those were the platforms in 2010 and 2011 that everybody thought you needed to be able to be successful with the new Affordable Care Act. And there are remnants of it, there are versions of it, but nothing like it was before. How about retail clinics? Remember, you were going to get all your health care not from the doctor's office, but from CVS and Walmart. And there's a few of them out there, but they've largely been closed. How about things like lean? We've talked about that here. Lean was so popular. Lean Six Sigma, everybody was doing it. Everybody was doing Gemba walks, and there's a handful of organizations still doing it, pieces of it that still exist in healthcare, but largely it's been replaced. Blockchain in of itself, medical records, everybody thought medical records were going to be digitized and signed by individual blockchain, and it's just too complex. Too many of those transactions would have to take place, and that's not happening as well. How about precision medicine? Now, I know there's a few things going on in there, and maybe more and more we're going to learn over time, but that was a big deal about 8 or 9, 10 years ago. And it turns out that there just aren't that many specific markers, that specific things that we can tie to the genetics of individual people that go. Now, again, we're starting to see a resurgence of that, but there was a big boom and bust for that as well. And how about this one? IBM Watson. Remember that one? Remember those commercials where Watson was going to solve all the healthcare problems, where it was going to like create absolutely new cancer treatments? Well, maybe we're going to get that with AI, but it certainly didn't happen with Watson, which is now defunct after people spent millions and millions of dollars with it. So what is this? What does this tell you? Why do intelligent people, really intelligent people, think that the risk is greater by not jumping on the bandwagon, by not adopting earlier? That's a greater risk. What is it about these signals that we get that make us do this? And again, I don't say I'm immune from any of this. If anything, I'm just like everybody else. We can all get caught up in this fear of missing out kind of phenomena. So what is it? Well, first of all, it really proves the thing that we've talked about a lot at Viral Healthcare, and that adoption is a social phenomena. There are so many inputs that we each see every day, so many choices, so many new alternatives, so many journals. I don't know about you, I can't even keep up with all the journals and all the evidence that's coming out. And somehow that creates uncertainty. And the way for us to decrease that uncertainty is to look around. See who else is doing it. So who else, if they've been successful, like why can't we? Why can't we just copy and do what they're doing here? Maybe our organization's not really the same kind of organization. Maybe we're not even ready to do what they're doing. But that whole idea that adoption is a social phenomena is really important. So we basically look around to reduce uncertainty, to try to generate a higher level of confidence that a decision we make is going to not fail on us if we've seen other people be successful. There's this other part, though, that's really important, and that imitation is highly rewarded. I mean, think about it. If you are part of some of these trends that go on and go out, things like Pokemon. Remember when everybody was running around cities and neighborhoods and parks looking for the Pokemon characters? Or how about the ice bucket challenge? I mean, one of the things that happened is if you were one of the first people in your area or in your group to do the ice bucket challenge, you kind of got status from some of those things. And it felt really good that you were kind of rewarded for being part of something bigger than yourself. And again, I'm not trying to talk down. I think the Ice Bucket Challenge accomplished a lot for the ALS program and other activities. It's not that they're wrong or not that I'm immune for that. It just explains a little bit about the rewards and the uncertainty that we're trying to manage our way through this. So, what should a smart executive do when there's a lot of hype going on, a lot of conferences, a lot of people posting reports, a lot of smart people out there really talking about something, maybe even consultants telling you this is the way of the future? What should you do? I think the most important thing is just to slow down. I mean, most of the decisions are not a race. There are very few decisions in healthcare and healthcare organizations that we need to move rapidly on. And we should ask questions like, is it right for us? Is it solving a problem we have? Is it important that we're not the first early adopter tax, or can we follow on somebody? I mean, this is one of the great things about Burger King, where they're not the first one in the location. They follow and let McDonald's do all the research for that. So, it's just thinking about how we would slow down to do all these kind of things. And then we should ask ourselves, is this our problem? Is this something that our organization is ready for? Is this something that is going to be reversible if we make a mistake? Or are we going to be embarrassed if we jump on and find out that it's not really all that it's cracked up to be? Can we wait and be equally successful? I would say most of the time, yes. The answer is yes. So if you're seeing trends that are going really rapidly, if you're at meetings where everybody is abuzz about these things, just pause for a second and just ask yourself, is this hype or is this reality? I'm Bruce Spurlock, and if you enjoyed this session, or if you enjoyed these kind of topics, join us on Viral Healthcare. We're on your favorite podcast platforms. You can see us on LinkedIn. And if you have ideas, bring them to us. We'd love to explore them. If you have a question, or if you have a fad or thing that you've seen this exact same thing happen on, we'd love to hear from you. So until next time, I'm Bruce Spurlock, and we're having fun looking at these trends and making changes.